What do you need to know about the most common food allergy in infancy, which is being allergic to cow milk? It affects about 75,000 infants a year who are born with a cow milk allergy, or a CMA. And it can be really frustrating, especially if you're first-time mom and you're trying to figure out what is going on with my kid. Does this baby have colic? Is it just fussy? What's going on? Do I need to burp it? But in reality, it might actually be your baby might be reacting to a milk allergy. Today, we're going to listen to Dr. Jenna Timboe, who is a pediatrician and a mom, who's going to tell us about how to recognize some of those signs, as well as what to do about those signs. Dr. Timboe completed her medical school education at Keck School of Medicine at the University of Southern California, and then she pursued a pediatric residency at the University of California, Irvine. She was also the chief resident there. She has been working in private practice as an outpatient pediatrician in Ladera Ranch, California since 2017. She and her husband, Andy, have 3 children, Haley, Robbie, and Weston. And Haley was actually 5 months old when she was diagnosed with a food allergy that Dr. Timboe took a special interest in and was able to do some additional research on, and now is going to share some of her findings with us. So thanks so much for joining us today, and enjoy this show. Welcome to the Teaching Your Toddler interview podcast, where we feature experts, authors, personalities, and entrepreneurs to help with everything related to parenting. Find out about us at teachingyourtoddler.com and enjoy the show.
This is Mary Jo Tinlin, and I would love to talk to you today about finding out if your baby has an allergy to cow's milk. So especially for a new mom, I bet this is pretty traumatic, but how do you know if your baby is allergic to cow milk?
Yeah, so there's a lot of various signs and symptoms. So definitely it's incredibly common. It's the most common food allergy in infants, and it affects about 75,000 infants in the United States every year. The symptoms could be wide ranging. So for example, if you're introducing regular formula or you're introducing yogurt as their starting foods and they have hives shortly after, that's pretty easy to recognize that your child may have an allergy. With that being said, there's a lot of other signs and symptoms that cow milk allergy could be possible. So if your baby's really fussy, if they seem like they have colic, if they have blood or mucus in the stools, or it seems like they're not gaining weight well, those would all be reasons to talk to your doctor about a potential cow milk allergy or what we could do to help. I was in that situation with my first child. She was absolutely miserable baby, even breastfeeding. And she wound up having an allergic reaction around 4 months old to regular formula, and then was diagnosed with a cow milk allergy. Over time, we wound up switching her to a hypoallergenic formula, and it literally changed our lives. And so I just urge you, if you have questions, to talk to your doctor. And that's why I'm so excited to partner with Nutricia in bringing Pepticate to the United States. It's a hypoallergenic formula that's been in Europe for about 30 years and is now an option here as well.
Oh, wow. That's so exciting. So what makes it hypoallergenic? What is the definition of a hypoallergenic formula?
Yeah, so you take the cow milk protein is a very large protein. So in these hypoallergenic formulas, or what we call extensively hydrolyzed formulas, they take the protein and they break it down into much smaller fragments. This makes it so that when the baby's drinking it, the immune system doesn't recognize it as an allergen, and they can take it without developing any symptoms. One large benefit of this formula, Pepticate in particular, is that it contains lactose, which makes it taste better. So we run into the issue I did myself with my own daughter, but also in my office as a pediatrician, where we recommend hypoallergenic formulas, but the kids won't take it because it doesn't taste good. So that leaves the parents really stuck and kind of fighting for help. So awesome that we have another option that tastes better, and kids therefore will take better.
And so my natural next question would be lactose. So we always hear about lactose intolerance because the protein is smaller, the molecule is smaller. Does that make it easier to digest, and so you don't see that lactose reaction?
Yeah, if you have concerns about lactose, I'd speak with your healthcare provider, but a lot less common in little babies than we'd expect.
Excellent. Gosh, yeah, I would think that a lot of moms might think that their baby's just colicky or fussy or, like you said, just, unhappy or whatever. And then if they can really break down and understand what's going on here, I'm sure that's so much better. Now, there's been some formula shortages recently. What can parents or moms do to help with that? Is this product pretty available?
It is pretty available. If you're looking to purchase it, you can go to their website, pepticate.com, or it's available on Amazon as well. But the formula shortage has been quite difficult to navigate for parents. Being a parent of a small child is stressful enough, and then have to be searching for formula on top of that. Just been a very tough year for parents and for us as pediatricians to try to help them. But if you're having trouble at this point locating a formula, definitely talk to us, talk to your doctor so that we can help locate what you need.
Absolutely. Perfect. Well, how can people learn more about this?
So you can go to pepticate.com to learn more, or you can speak with your doctor.
Excellent. Thank you so much, Doctor, for speaking to us today.
Thank you.
Mm-hmm.
This has been the Teaching Your Toddler podcast with Mary Jo Tinlin. Thank you so much for joining us today. I hope you'll find us on our website at teachingyourtoddler.com, as well as on Facebook at Teaching Your Toddler, on Instagram, and on Twitter at Teaching Toddler. So join us again, and I hope you have a wonderful week. Thank you so much.